how would you recommend that someone who is a role model for a younger therapist recommend someone get started on that self-care journey? How do you open up that conversation and steer someone in the right direction when everyone has such different self-care needs?
Well, I think you hit the nail on the head with a little bit. Like we always, whether we're talking about ourselves or with clients, we always want to start with the basic needs. Are the basic needs being met? And if they're not, that's a big thing to pay attention to.
Big red flag.
Big red flag.
Not showering.
Right.
Red flag.
Welcome to grad school.
That's right. We shouldn't have to feel guilty about creating time to take a shower. We shouldn't have to feel guilty or shame for creating time to eat lunch or go to the bathroom. Those kinds of things happen, and sometimes there are productivity requirements that get in the way, and it feels like it's very true. My job is on the line. I have to fit in 10 patients a day in order to meet productivity requirements, so I can't eat lunch or go to the bathroom. Those, again, are conversations that I support people to self-advocate, and talk to supervisors, talk to colleagues, talk to HR representatives to try to change some of those things. You said filling the bucket earlier, which is very true. We have to fill our own bucket before we can fill other people's. And on a physiological level, we will get very, very sick if we don't do those kinds of things. And then what good are we to anybody? And from an organizational perspective, it's much more affordable. It's much more economically friendly to help people take care of themselves on the front end than have to deal with crises on the back end. So there are a lot of talking points that I encourage people to use if they're trying to implement some of those basic routines. If you are your own boss, those are great places to start. Making sure that you're eating, drinking, that you have a little break time from work. And what that actually looks like for each person is very individualistic. But I think starting with the basic needs is fundamental for a reason.
Food, water, shelter.
Right. And that's a great point, Jennifer, because if all of you in speech therapy graduate school learned about Maslow's hierarchy of needs, when we relate that to our child patients, when we have those basic needs met, we can go up that triangle and do all the other things that are expected of us. If we don't have those basic needs met, we don't feel safe in the world. And so we're not able to access our good thinking cortex in order to make decisions and write treatment plans and respond spontaneously in a visit when a child might be aggressive or whatever that might be.
Yes, I love thinking about having those basic needs met first. And at first, it sounds kind of trivial and funny. But when I think back on my previous jobs as a on-site clinician, it was like, when do I even go to the bathroom? Like, okay, I guess I'll dehydrate myself all day because I don't have access to a bathroom in home health and I don't have time to stop. And then I'd be so thirsty when I came home and very irritable. And so thinking about really from the ground up, I think is really a helpful starting point.